So, as you understand, we're going now to learn a new system that's called the digestive system. Yay. I have here all the intestines outside. Oh, wow, lots. And we're going to start, actually it will make sense to start here. Imagine that this is going to be the mouth. And we can put it maybe somewhere like that. Yeah, I beg your pardon? Yes.
I don't mind.
Yeah, you don't mind? Okay. Oh, how do we get this one into? Oh, sorry, the teeth fell.
Not just arms,
I'm
but
sorry.
teeth.
I have a good dentist, don't worry. Okay, so we're starting with the mouth. And now we have to see how food goes onto the other side. Yeah? Good, so let's start. What do you think happened? What's the name of this structure underneath the mouth?
Esophagus.
Esophagus. And basically it's just a tube, right, that brings the food down. Yeah? If we take this person and invert it, so his head down, and he will eat, does the food still go up into his stomach?
Yes.
Yeah? How come? It's against the gravity.
There's muscle.
There is squeezing movement. So basically this esophagus is made up of muscle. So whatever food that you put in, it would start kind of milk it down. So if you were turning on your head, it would still push the food upward. Right, so food goes down. What's the next stop after the esophagus? Stomach. Right, so basically imagine that this part now, instead of being kind of tube-like, is going to expand into a sac. Yeah? So it will be a continuation of the same tube, but now it will be a sac. Now, where the stomach is, the stomach looks something like, it's called a J shape. Like that. Yeah? Now some people have a quite flat J shape. Some people, the stomach can go really low. So, yeah, something like that. So it's very hard to know where the stomach exactly is. Okay, but let's say this is the stomach. And what do we have after the stomach? The intestine. Now we have two types. Small, that they're actually thin, and large, that is actually wide. So we start with the small intestine. Now, the problem is, look, we have lots of stuff to put in, yeah? So really, what the body does, it does something like that. And here we come to the help of the connective tissue. Quite a lot, isn't it? Then we're kind of, so this is all lump of the small intestine, and what it does, it's kind of just, come on guys, in please, in, right, and now it adheres into the spine. So I need a bit of connective tissue. Maybe the camera can come closer. Yeah, yeah, and wrap it just like that. Yeah.
Nice both.
Yes, strong, please. Good. Yeah, good. Okay. So, imagine this is now all of the intestines. I mean, in nature is much nicer. I must admit, I'm not very patient to do that. Yeah. And now we have all the intestines in here. Good. Stay there. Now stay there. And now, next what we have is the large intestine. Yeah? And the large intestine, no, that's fine. We need also other connective tissue. Good. Now, the large intestine does something like that. It starts from the right side, and it goes up. And we need a bit of more connective tissue here. So you need to wrap that. And actually it adheres to the ribs. When you think about that, the ribs is kind of creating a frame of the whole digestive system. Then it goes across to the other side. We need another one here. Good. Yeah. And all of these are collagen fiber ligaments, and they attach the digestive system into there. Okay, we have a little bit too much left. Let's say that from there, so we're having the large intestine goes like that. It starts from the right side, it goes up, across, down, and then what it does is kind of disappeared into the hip and goes all the way in just in front of the sacrum and end in the anus. Yeah? So altogether, how long roughly the digestive system is?
3 meters?
Sorry?
3 meters?
6 meters.
I think, I don't know, I forgot. Maybe 7 meters, yes. I think something like 20 or 30 feet. So quite long, and it's all wrapped around there all the time. So again, the mouth, esophagus, stomach, small intestine all over, and then the large intestine has kind of a U-shape, start from the right lower side, up, across, down, and into the hip. Now what we also need to think is about us massage therapists and the digestive system. Okay, first of all, we did the skin, remember? So when you touch the abdomen, what does it mean for the person? What is a symbol that we feel around our abdomen? Sensitive?
Vulnerable.
Vulnerable? Yeah, very much vulnerable. Isn't it? Is it a place that is very easy for you to expose or to be touched?
No.
No? Very personal as well?
Especially the
Could
belly
be
button.
ticklish? Sorry?
Especially the belly button.
Belly buttons, yeah. What is it English we're saying about the abdomen or the stomach when it comes to sensitivity? Ticklish? You've been punched. It felt like someone punched you in the gut or the stomach. So it's very sensitive area. So that by itself, we need to remember when we give massage to people with on the abdomen. It might not be the first thing that you're going to do. Consider that, yes? But imagine who would be good to receive treatment on the abdomen. On which circumstances you might think, that might be something that I may suggest to the client.
If they've been coughing a lot.
Yeah, why coughing?
Because it contracts.
Contract the muscles here, yeah.
IBS.
IBS, irritable bowel syndrome, digestive problem.
With the veins problem.
Maybe, yes.
Yeah.
Remember that if you have varicose veins, it might be because there is pressure on the abdomen and the veins just, yeah. Varicose vein, very good one.
Constipation.
Constipation, yeah. To ease off the stress and the tension there.
What if you recover from a hernia?
Recover from any abdominal maybe surgery, hernia, or hysterectomy even. What about pubic menstrual cycle pain? It might soothe that area as well.
Really?
Maybe.
What about constipation?
Not from my experience, but from my client experience, some of them, yes. Some of them it might be. Some of them, it will be the last thing that they want to actually be touched around, yeah? Absolutely. So you see there is no right and wrong, but it's like what we're saying, negotiation and treatment option to them, and they might say, oh, let's give it a try, or no, I don't think so. Good. this is what we're going to learn now. We're going to go station by station and see what in each station of the digestive system things happen, but we should never forget about the whole, about this long tube and how it goes sometimes, and it may look like that, even worse. It's very gutsy. It's full of stuff, full of organs, and we want to maybe also help by improving their movement. Imagine that someone, Renata, may I have the chair, please? Yeah, thank you. Good. Imagine to this person what would happen if they, to their digestive system, if they're sitting like that. Compacted. Are there going to be a lot of free movement between all of this? No. Blood circulation. And you can see why 20% of European population sick of irritable bowel syndrome. 20%, so it's 1 in 5. Yeah? So what can we do in terms of massage? You need to think about it pretty much like any other areas of the body. You try to improve movement, you try to improve circulation and relaxation. So we will work actually tomorrow after the clinic day in mobilizing the ribs, for example. Now if you mobilize the ribs, then all of these areas underneath will move as well. Liver, on spleen here, stomach in the front left side, moving the hip, putting the client on the side and stretching the side, stretching the other side, yeah? And massaging as well around the abdomen itself, yeah? But really you're looking at this frame of skeleton, and when you're moving the frame, you're moving the content inside, yeah? Food for thought, and good, we can stop now, and any question before? No?
Oh,
Bye bye.